Welcome everyone to our How to Pass the NCLEX live training. We are on day number 11. So 10 days have passed already. We have been sharing some very valuable information, some very interesting questions. So if you haven't seen the previous 10 days, go back to our YouTube channel, NCLEX Crusade International, and find the videos. In today's training, we're gonna talk about cardiac tamponade or cardiac tamponade. I know there's different pronunciations out there. I like to say cardiac tamponade. So that is the topic of today's training, and here is the question we're gonna practice today. It's a selector apply, but we're gonna use the opportunity to discuss some important information for the NCLEX about cardiac tamponade. The question states, the nurse is assessing a client who has a pericardial effusion. Which of the following findings would indicate that the client is experiencing cardiac tamponade? So this is a selector that apply. You have 5 options to identify which of these 5 options relate or are symptoms of a patient with cardiac tamponade. So I will be giving the answer to this question at the end of the video. Let's begin with what is cardiac tamponade. Cardiac tamponade is an abnormal increase in fluid accumulation where in the pericardial sac. So what is cardiac tamponade? It is an increase, keyword, increase in fluid accumulation in the pericardial sac, which by raising the intracardiac pressure impedes, keyword, impedes normal cardiac filling and reduces cardiac output. Okay? So why is this important? Why is this important for me as a nurse? Because these pathophysiological changes can be so severe and resemble symptoms of heart failure. Now, here is a good NCLEX tip that you need to remember, and this would make sense in understanding what cardiac tamponade is. Remember that normally the pericardial sac contains about 20 ml of fluid, which is needed to decrease the friction from the beating heart. So this is a protective fluid, but contains about 20 ml. When the accumulation of fluid exceeds this number, then we start having problems. What are some cardiac tamponade clinical features or clinical symptoms? We're going to use this awesome UWorld photo, and I use this opportunity to say UWorld is the best in photos in nursing. They are the best. I love their photo, the description, the details, and I want to use this opportunity to show you the clinical features of cardiac tamponade. So basically, we can see here in this image distended neck vein or jugular vein distension. We can also see distended vena cava. We can see the pericardial infusion like it was described on the scenario. We can see a reduced left ventricular cavity space and interventricular septum deviation. So assessment findings that are very important: a narrow pulse pressure, muffled heart sounds, and distended neck veins. Those are the 3 main findings, okay? So 3 main clinical features of tamponade known as the Beck's triad is hypotension, muffled heart sounds or absent heart sounds, and jugular venous distension or jugular vein distensions. Now, there are limitations of ventricular filling and reduction of cardiac output. So basically, clinical manifestations may resemble those patients that have a heart failure. So when you see the clinical manifestation for cardiac tamponade, it could be similar to those of a heart failure. You can see dyspnea, orthopnea, and even hepatic engorgement. So what is a consequence of this cardiac tamponade? Well, we can see deviation of the interventricular septum. Why? Why do we see deviation of the interventricular septum? Why? What's the reason behind this? The reason is because there is reduction of the cardiac venous drainage. As you can see on the image, how the interventricular septum is deviated to the left, okay? Which confirms that in this condition, the right ventricle is managing greater volume, greater pressure than the left ventricle. Remember, in normal condition, it's not like that. In normal condition, the left ventricle manages greater pressure, greater volume, because it needs to send oxygenated blood to the rest of the body. But in this condition, because of the pericardial effusion, that is creating pressure, and the right ventricle now is managing greater pressure, and that is why we can see the interventricular septum deviation. Okay? Now, sometimes there is no obvious cause of pericardial disease, but whenever we see these symptoms, okay, we should be considering a cardiac tamponade in any patient with a hypotension and elevation of the jugular venous pressure. So it is important to distinguish cardiac tamponade from any other cardiac pathophysiologies, okay? Because we can see the presence of paradoxical pulse. And what is a paradoxical pulse? So we need to understand certain clinical findings that associates more to cardiac tamponade and not to other conditions. Because as I told you, some of the symptoms can be very similar in other conditions like of heart failure. So we need to distinguish the symptoms in cardiac tamponade from other pathophysiology. So when we see the presence of a paradoxical pulse, what is a paradoxical pulse? So basically consists of a decrease of more than 10 millimeters of mercury in systolic arterial pressure. Now, this happens especially when we tell the patient to take an inspiratory breath. So if we ask a patient to take an inspiratory breath and we see a decrease of more than 10 millimeters of mercury in systolic arterial pressure, that indicates a paradoxical pulse. It can also be detected by palpating weakness or disappearance of the arterial pulse during inspiration. So what are you saying, Professor? What can I conclude with this information? In conclusion, when you ask a patient with cardiac tamponade to take a deep breath and to inspirate, the final volume of the right ventricle will increase and it will produce a reduction of the final volume in the left ventricle. So the cardiac output is more compromised in the left ventricle, basically determining the changes in the arterial pulses and systolic blood pressure. So if we see these clinical manifestations of a paradoxical pulse, we can think of cardiac tamponade in addition with every other clinical finding that we have described so far. Okay? Now, what are the three most common causes of cardiac tamponade? Who knows? Who knows the three most common causes? If you know, if you can think of this, comment in the comment section, whether it is on YouTube, Facebook, or wherever you're seeing this transmission. What are 3 common causes of cardiac tamponade? What are they? 3 most common causes: neoplastic disease, basically lung, breast, lymphoma, leukemia, idiopathic pericarditis, and pericardial effusion secondary to chronic renal injury. Okay, let me change this slide real quick here so you can see it completely, everything that I wrote here. There you go. Should be a little bit better there. Okay, so these are the main 3 causes. Now, there are other causes. For example, we can see pericardial cardiac perforation during cardiac catheterization. That could be a cause. Percutaneous coronary interventions. We've talked about this in the past few days. Aortic dissection. We talked about that in a previous live. Insertion of a pacemaker wire. Drug-induced, for example, medications such as procainamide, hydralazine, phenytoin, isoniazid for tuberculosis, anticoagulants, and other medications. Other mixed edema coma, the complication of hypothyroidism, also could be of an infectious cause. For example, a virus, we could see the Coxsackie virus, A and B, HIV, bacteria, we can see pneumococcus or staphylococcus, streptococcus, mycobacterium tuberculosis. Fungal causes could be Candida albicans, histoplasmosis, and of course, trauma and autoimmune diseases can be a cause of cardiac tamponade. What is a diagnosis? How do we diagnose cardiac tamponade? Number 1, X-ray. We can see an enlargement of the cardiac silhouette due to the pericardial effusion. If we do an electrocardiogram, a 12-lead EKG, we can see tachycardia, low voltage, and electrical alternance on the P, QRS, and T wave. I'll show you in a minute what that is. Basically, if you see this electrical alternance, you should be suspicious of cardiac tamponade. An echocardiogram, definitely either transthoracic or transesophageal, will be a good diagnostic procedure to confirm the quantity and the amount of pericardial fluid. CT, computer tomography, MRI, magnetic resonance images, and here we can see what the electrical alternance is. So basically, electrical alternance is defined as the alternating P or QRS amplitude, okay, in any of the leads of the electrocardiogram. So if you can see changes in the amplitude of these P or QRS complexes, you could think that this could be an indicating of cardiac tamponade or maybe other cardiac pathophysiologies. The treatment for cardiac tamponade, number 1, pericardiocentesis, which is a puncture of the pericardial sac, basically to aspirate pericardial fluid. We can see here how the procedure is done. And lastly, pericardiotomy, basically under general anesthesia, a portion of the pericardium is excised to permit the exudate of pericardial fluid to drain into the lymphatic system. And also, it is used to place a surgical drainage in patients that recurrently have cardiac tamponade. So this is a very interesting image to show how a pericardiotomy is performed. And lastly, a pericardiotomy is also used to obtain a biopsy for diagnosis. So you have a quick overview of what cardiac tamponade is. Now let's go back to the original question. Which of the following findings will indicate that the client is experiencing cardiac tamponade? Number 1, muffled heart tones. We talked about it in one of the clinical findings. We can hear distant or muffled heart tones. So number 1 makes perfect sense. Good, perfect sense. Good answer. Number 2, jugular venous distension. Jugular vein distension. That is another finding. We talked about it. So number 2 is a good answer. Number 3, bounding peripheral pulses. Where can we see bounding peripheral pulses? Bounding peripheral pulses is more associated with fluid overload, also with hypertension, fever, anxiety, okay? But in cardiac tamponade, remember that this condition causes a decrease in the cardiac output, and the patient is likely to have weak, thready pulses, not bounding peripheral pulse. So it's the contrary, okay? Number 4, blood pressure of 80/60, hypotension. Remember, we can see hypotension and a narrow pulse pressure. So number 4 is a good finding. Now, I want you to take a second to analyze answer 3 and 4. And this is a good strategy that I like to use in Select.Apply. Whenever I see in a Select.Apply 2 answers that are opposite to each other, that makes me think that one of the answer is incorrect. For example, 3 and 4 are opposite to each other. And also 2 and 4 are opposite to each other. Why? If we see hypotension, we're not going to see bounding peripheral pulses, right? Because they're opposite to each other. So if we already selected that we can see a jugular venous distension from the accumulation of fluids, and we can see those symptoms similar to heart failure, then if we see bounding peripheral pulses is opposite to a blood pressure of 80/60. So one of them is incorrect. We already said that we're likely to see not bounding peripheral pulses, but we would usually see what kind of pulse? Weak and thready. So 3 is incorrect. And if 3 and 4 are opposite to each other, usually 4 would be a correct finding. So with this analysis, I can confirm the elimination of answer number 3. So I have 1, 2, and 4. And lastly, decrease breath sounds on the left side. So this is specifically on the left lung, on the left side. Where can we see decrease in breath sounds only on one side, on the left side? Well, this is not specific to cardiac tamponade. This could be maybe atelectasis, maybe from a pleural effusion or pneumothorax, but it's not indicative of cardiac tamponade. So, to conclude, in this scenario, they were talking that the patient had a pericardial effusion, which is an accumulation of fluid in the pericardium. As a complication of this pericardial effusion, the patient developed cardiac tamponade, which you know is a serious complication of pericardial effusion. Life-threatening, okay? Life-threatening, because the heart is compressed from the fluid buildup and is not able to pump effectively. All right? Now you understand the clinical manifestations of cardiac tamponade. If you are watching every single video that we have put in this international YouTube channel from day 1 to day 10, which is today, guys, you are supposed to be almost becoming an expert in cardiology, an expert in cardiovascular conditions, because we have talked about everything. We have talked about the anatomy and physiology of the heart. We have talked about different heart valves. We have talked about different pathologies. So little bit by little bit, we are giving you information to really understand the conditions that can appear on the NCLEX that relate to cardiovascular system. And we're not going to stop there. We're going to continue probably for a few more weeks talking about cardiovascular system. But then we're going to switch to the respiratory system. We're going to do maybe a few weeks of training on a respiratory system. But then we're going to go to endocrine system. And week by week, we're going to be talking about different systems and different pathologies. So I hope that you are enjoying these trainings that we're doing here 3 to 4 times a week. If you like this training, make sure you like our video. Make sure you subscribe to our YouTube channel so you don't miss any of the information. Our next live is going to be next Wednesday, okay? So next Wednesday, probably around 11 a.m., 11:12, we're going to be doing another live. And guess what? We're going to be talking about shock. So do you need help understanding the different types of shock? Do you want to learn about the different clinical manifestations, the treatment in a patient with shock? Like, for example, what is a septic shock? What is a neurogenic? What are all the different types of shocks that appear on the NCLEX that they could test you on the NCLEX? We're going to talk about it on Wednesday's training. So if you want to see that live training next Wednesday, hit that like button to show the support to our YouTube channel. Okay, remember, share this presentation with other nurses out there. Here is the membership. If you're looking to join our membership, I have provided the link to join our membership in the description in the YouTube channel. My advisor is also putting the link on the comment section. So if English is your primary language and you want to do our English International membership, here it is. If you speak Spanish and Spanish is your primary language, we have a Spanish bilingual membership. It's called the Gold membership. Here are the pricings for the Gold membership. We're also going to put the link in the comment section and also in the description. Then if you want to talk to our academy, here is the number to contact the academy. Thank you for trusting NCLEX Crusade International. Thank you for joining us every live that we put out here. All the time you guys are coming. Sometimes we have 100 join, sometimes 300, 800, up to like 900 participants we've had in our YouTube live training. So thank you for being here. Come back in the next training. God bless you all.